The fluorescent lights flickered once, then died, leaving the empty shelter hall in near darkness. Rows of cots sat untouched, as volunteers scrambled to unpack emergency supplies. Outside, the streets were slick with floodwater, traffic at a standstill. It was September 11th, 2001. Not a terrorist attack, but Hurricane Iris's aftermath in New Orleans. This was the scenario planners had feared for decades, a major disaster exposing how unprepared the nation really was. Emergency crews discovered that communication lines were overloaded and rescue boats were insufficient. Transport routes clogged, leaving thousands stranded. Hospitals were overwhelmed, supplies misrouted, and the command structure fractured. The storm itself was violent but predictable. Meteorologists had tracked Iris for days. Models projected catastrophic flooding in low-lying neighborhoods. Yet evacuation orders were delayed, and emergency shelters could not accommodate all residents. Interagency coordination failed at nearly every point, despite contingency plans on paper. Those plans assumed infrastructure that could no longer function. Highways blocked, power down, and communications fractured. In the first 48 hours, it became painfully clear that systems meant to save lives were vulnerable. Investigators later cataloged a litany of failures in the emergency response chain. Who was in charge, who could authorize resources, remained ambiguous. Medical facilities ran out of beds, and ambulances were stuck in flooded streets. Volunteers had supplies but no guidance on where to deploy them. Redundant systems were either inaccessible or improperly maintained. Even basic logistics, moving food, water, and medical equipment, collapsed under the stress. The storm revealed a systemic unpreparedness. Planners underestimated the human scale of evacuation and the fragility of transportation networks. Shelters were empty not because citizens didn't need them, but because access was blocked and communication had broken down. Rescue convoys stalled in gridlocked streets. Local authorities were forced to improvise command decisions while the disaster unfolded. The city, state, and nation had assumed a resilience that did not exist. Infrastructure, emergency systems, and coordination protocols were only as effective as the real-time decisions that activated them. In those crucial first hours, the system failed. The aftermath would force a national reckoning with the assumptions embedded in disaster planning. Hurricane Iris became a case study in the fragility of American preparedness. The morning after Hurricane Iris struck, the scale of the disaster became painfully apparent. Streets that had once been thoroughfares were now rivers of debris and standing water. Neighborhoods that had been densely populated were eerily silent. What was striking was not just the physical destruction, it was the failure of systems meant to prevent chaos. Emergency shelters sat nearly empty, with supplies untouched. Families trapped in flooded homes went without food, water, or medical care for hours. The logistics of rescue, supply distribution, and medical response had collapsed. In the days leading up to Iris's landfall, forecasters issued detailed predictions. The National Weather Service identified the most vulnerable districts, forecasting severe flooding in low-lying areas. Yet those warnings never translated into coordinated action. Evacuation orders were inconsistent. Some local leaders hesitated. Others issued voluntary guidance that many residents either ignored or could not follow. Buses and emergency vehicles were insufficient in number to move residents efficiently. Even for those able to leave, roads clogged with stalled traffic slowed evacuation. Once Iris made landfall, the weaknesses became glaring. Flooding cut off access to hospitals, trapping patients, and limiting the mobility of medical personnel. Power outages disrupted communications, rendering phones and radios unreliable. Emergency operations centers made critical decisions without complete information. Volunteers arrived with supplies but lacked centralized direction. Local law enforcement was stretched thin, trying to maintain order while facilitating rescues. The federal response became delayed and fragmented due to miscommunication. Investigators later mapped a detailed chronology of these failures. In many cases, the emergency infrastructure existed only in theory. Evacuation routes assumed open roads, but street flooding rendered them impassable. Emergency shelters were planned to accommodate thousands, yet access points were flooded. Staff were inadequately trained, and supply chains failed to deliver promptly. Communication lines were overstressed and fragmented, leaving local responders unable to coordinate effectively. Redundancies meant to act as backups were compromised by the same vulnerabilities. Particularly revealing was the breakdown in command and coordination. Disaster management protocols assumed a clear chain of authority, but in practice, decision-making was muddled. Who had the authority to declare mandatory evacuations became the subject of confusion. As a result, multiple agencies duplicated efforts while other neighborhoods went neglected. This mismatch created critical delays that directly affected residents' welfare. Medical response highlighted another systemic weakness. Hospitals were overwhelmed by the number of patients and supply chain disruptions. Ambulances could not navigate flooded streets, forcing ad hoc triage. Emergency medical teams had limited access to water, electricity, or sanitation. Transporting intravenous fluids became a challenge when supply routes were blocked. Preparedness requires resilient infrastructure capable of functioning under extreme conditions. The city's response to stranded residents underscored the same problem. Volunteers and National Guard personnel struggled to locate people trapped in floodwaters. Maps used for planning were outdated or failed to account for the storm's path. Rescue operations became reactive rather than proactive. This experience highlighted the need for dynamic decision-making capabilities in disaster management. Effective planning is a combination of robust infrastructure, flexible logistics, and clear communication. Afterward, the gaps identified became a blueprint for nationwide reform. Federal and state agencies recognized that emergency systems needed to function under failure. This led to the development of redundant communication networks and flexible command structures. Hurricane Iris prompted planners to rethink the assumptions underlying disaster preparedness. The storm had proven those assumptions dangerously optimistic. Training and public education became a central focus of reform. Drills simulated flooding scenarios, communication breakdowns, and logistical bottlenecks. Residents were taught evacuation routes and how to respond when systems were compromised. Emergency agencies invested in technologies to ensure critical decisions could be made under duress. The disaster illustrated that resilience was about organizational flexibility and public awareness. Infrastructure improvements were also a direct response to Iris. Flood control systems and levees were redesigned to account for extreme conditions. Roads and bridges were evaluated for their reliability in disaster scenarios. Shelters were retrofitted with backup power, water reserves, and redundant supply systems. Emergency operations centers adopted digital mapping and real-time tracking. Every aspect of preparedness was reconsidered in light of the systemic failures revealed by the storm. Perhaps most significantly, Hurricane Iris changed the philosophy of disaster management in the United States. It exposed the danger of assuming that plans on paper would function flawlessly in reality. The disaster demonstrated that preparedness is not merely a checklist of supplies or protocols. It is a living system that must anticipate uncertainty, human behavior, and the cascading effects of infrastructure failure. Agencies began adopting scenario-based planning, stress-testing communication networks, and developing contingency strategies for multiple points of failure. The lesson was clear. Disasters reveal the vulnerabilities of human systems. True preparedness requires anticipating failure at every level. The reforms inspired by Iris extended beyond New Orleans and Louisiana. Federal agencies incorporated lessons into national standards for disaster response, emphasizing coordination between city, state, and federal authorities. Redundant communication networks, improved evacuation planning, and flexible logistics became central to emergency management doctrine. Cities across the country adopted similar strategies, focusing on resilience not only in physical infrastructure, but in command and control, medical response, and public engagement. The storm had demonstrated that unpreparedness is not simply a local issue. It is a systemic risk that can escalate rapidly without coordinated action. Hurricane Iris became a defining moment in American emergency planning. It was not the most deadly or destructive storm in U.S. history, but its value lay in what it revealed: the fragility of systems we assume are robust. By exposing gaps in logistics, infrastructure, communication, and coordination, it forced planners, engineers, and policymakers to confront uncomfortable truths about vulnerability. The reforms that followed, redundant systems, robust training, improved infrastructure, and better public communication, reshaped the nation's approach to disasters. IRIS proved that preparedness is a living, adaptive process. Even a foreseeable storm can become a disaster if the systems designed to respond fail in practice. By the time the floodwaters finally receded and power was partially restored, the human toll of Hurricane Iris was evident. The lessons painfully learned about systemic unpreparedness were striking. Empty shelter halls, stalled convoys, and clogged streets had become symbols of a broader failure. America's emergency systems were fragmented, under-resourced, and too rigid to adapt to a crisis of this scale. Officials realized that disasters don't just test physical infrastructure, they expose the limitations of coordination, communication, and real-time decision-making. The aftermath sparked a nationwide reckoning. Federal and state agencies worked to redesign disaster response around the principle that redundancy and flexibility are as critical as speed and authority. Evacuation planning was overhauled to account for transport limitations, access to shelters, and the needs of vulnerable populations. Emergency operations centers integrated digital mapping and real-time data. Training programs emphasized improvisation under stress. Communication protocols were standardized, ensuring that warnings would reach residents directly and unambiguously. Infrastructure itself became a focus. Roads, bridges, and levees were reassessed not just for durability, but for their ability to support mass evacuations and sustained emergency operations. Hospitals and shelters were retrofitted with backup power, water, and supplies. National guidelines were established to maintain coordination between local, state, and federal responders. IRIS had proven that preparedness is not a static plan. It's a living system that must anticipate human behavior, environmental uncertainty, and cascading failures. The legacy of IRIS endures today. Emergency response in the U.S. now emphasizes resilience across systems, rapid communication, and pre-planned logistics capable of functioning under extreme stress. What began as an unremarkable storm revealed the fragility of America's preparedness. In response, the nation rebuilt its disaster systems stronger, smarter, and more adaptive. The empty shelter halls, flooded streets, and stalled convoys were no longer just failures. They became the blueprint for a country learning to survive its next inevitable catastrophe. The aftermath of Hurricane Iris did not simply leave a trail of physical destruction. It left a stark, unignorable reflection of systemic vulnerability across the United States. In the days following the storm, emergency managers, government officials, and federal investigators descended on New Orleans and the surrounding parishes. They attempted to piece together a coherent account of what went wrong. The images were familiar: empty shelter halls with unopened supplies, vehicles stranded in flooded streets, bridges blocked by debris. Yet these images were only a symptom of a deeper problem. They revealed a comprehensive breakdown in the systems designed to anticipate, mitigate, and respond to disaster. Every failure, whether logistical, infrastructural, or organizational, contributed to an overarching lesson. America's disaster preparedness infrastructure was not merely insufficient, it was fundamentally untested under real-world conditions until Hurricane Iris. From the earliest forecasts, meteorologists had tracked Iris with precision. Satellite imagery, wind projections, and storm surge models all indicated a major threat to low-lying coastal communities. The National Weather Service issued multiple warnings days in advance, highlighting potential flooding, wind damage, and the need for evacuation in vulnerable zones. In theory, local authorities and emergency management agencies were prepared to act. They had pre-existing contingency plans, designated shelters, and evacuation protocols. But in practice, these systems were built on assumptions that quickly proved flawed. Evacuation routes presupposed open roads and functional bridges. Shelters assumed accessible access points, sufficient capacity, and staff availability. Communication relied on both outdated infrastructure and protocols that assumed uninterrupted power and telephone service. The storm demonstrated that even the most carefully documented plans could fail if the supporting conditions did not exist in reality. Evacuation, a critical pillar of disaster preparedness, exemplified the systemic gaps. In theory, residents of high-risk neighborhoods would receive timely alerts and have access to transportation, safe routes, and designated shelters. In practice, the delays were manifold. Local officials hesitated, weighing the economic and political consequences of declaring a mandatory evacuation. Voluntary guidance was inconsistent, creating confusion among residents, particularly the elderly, low-income, and those without personal vehicles. Once roads became clogged with stalled vehicles and flooded streets, evacuation plans were effectively rendered moot. People who had intended to leave found themselves trapped, while others delayed action, misjudging the storm's severity based on incomplete or contradictory information. Communication failures compounded these logistical problems. Early warnings issued via radio and television were unevenly distributed. Local broadcasters sometimes altered bulletins to avoid causing panic. Telephone lines, already heavily used, became overloaded. Emergency operations centers struggled to coordinate resources. Even within agencies, communication chains were fragmented. City, parish, state, and federal offices lacked a unified command structure. The result was a system that failed to ensure timely action after landfall. Hospitals and emergency shelters bore the brunt of these systemic weaknesses. Flooded streets prevented ambulances from reaching patients. Hospitals ran out of essential supplies, forcing improvisation. Shelters intended for thousands sat empty, while neighborhoods were unassisted. Volunteers arrived with help, but their efforts were often misdirected. Critical resources were concentrated in some locations, but not in others. This highlighted a crucial lesson about disaster response logistics. Without clear authority and real-time communication, resources become useless. The storm exposed the fragility of infrastructure. Roads and bridges were compromised by flooding and debris. Power grids and communication lines collapsed under strain. The assumption that infrastructure would hold under stress proved optimistic. Once these systems failed, the consequences accelerated quickly. Planners had modeled worst-case impacts but underestimated simultaneous failures. This highlighted a vulnerability in preparedness philosophy. Resilience is about redundancy and adaptability under stress. A comprehensive overhaul of disaster preparedness began after Hurricane Iris. Federal agencies implemented standardized protocols for interagency coordination. Responsibilities for evacuation and response were clearly delineated. Emergency operations centers upgraded with redundant communication systems. Evacuation planning incorporated lessons learned from the storm. Shelters were retrofitted for capacity and accessibility. Public education became a central component of preparedness reforms. Citizens were trained in warning levels and evacuation procedures. Annual drills simulated communication breakdowns and shelter bottlenecks. These exercises emphasized informed action as vital to survival. Meteorology, logistics, psychology, and urban planning were integrated into a comprehensive approach to emergency management. Medical response systems were similarly transformed. Hospitals developed contingency plans for rapid patient triage under conditions of limited access. Pre-positioned medical supplies were strategically located to facilitate distribution even if transportation networks were compromised. Ambulance and rescue fleets were augmented and trained for deployment under adverse conditions. Coordination between federal, state, and local medical units was formalized, enabling faster mobilization of personnel and resources. This ensured that the systemic weaknesses exposed during Iris would be addressed before the next disaster struck. Infrastructure investments followed as well. Roads, bridges, and levees were reevaluated not just for everyday use, but for reliability during disaster events. Flood control systems were redesigned to accommodate extreme scenarios. Shelters were equipped with backup power, water storage, and logistical support to maintain operations independently. Urban planning incorporated disaster resilience as a core principle. Perhaps most importantly, Hurricane Iris reshaped the philosophy of disaster preparedness in the United States. Planners, policymakers, and emergency managers realized that a plan on paper is insufficient without real-world testing, redundancy, and adaptability. The disaster demonstrated that the systems intended to save lives are only as effective as the human, organizational, and infrastructural elements that implement them. Preparedness was no longer viewed as static. It became a living, adaptive system that must anticipate uncertainty, human behavior, and cascading failures across multiple domains. The lessons of Iris extended beyond Louisiana. Federal guidelines were updated to provide standardized coordination frameworks, redundant communication protocols, and dynamic evacuation planning applicable nationwide. Cities across the Gulf Coast and Atlantic seaboard adopted similar measures, focusing on resilience in infrastructure, communication, logistics, and human response. The storm's legacy influenced urban planning, emergency operations, medical preparedness, and public education, creating a culture of readiness where delays, miscommunication, and systemic gaps could be mitigated before they became catastrophic. Hurricane Iris may not have been the deadliest or most destructive storm in U.S. history, but its impact on preparedness and emergency management was profound. It exposed vulnerabilities at every level: logistical, infrastructural, organizational, and human, and forced a comprehensive re-evaluation of what it truly means to be prepared. Empty shelters, stalled convoys, flooded streets, and fractured communication systems became more than cautionary images. They became the blueprint for nationwide reforms that would save lives in future disasters. Today, the legacy of Iris endures in the systems designed to prevent similar failures. Emergency operations centers are coordinated and well-equipped, communication networks are redundant, evacuation plans are standardized, and citizens are trained to act decisively when warnings are issued. The storm transformed the nation's understanding of disaster response. That resilience is not solely about engineering or forecasting, but about the seamless integration of infrastructure, logistics, communication, and human decision-making. In this way, Hurricane Iris did more than reveal America's unpreparedness. It reshaped the nation's approach to survival, ensuring that when the next disaster arrives, systems are ready, people know what to do, and tragedy is mitigated before it can unfold. The flickering lights of an empty shelter, once a haunting symbol of systemic failure, now stand as a reminder of a nation that learned, adapted, and rebuilt its disaster response from the ground up, proving that preparedness is not merely a plan, but a living, resilient network capable of saving lives when the storm hits.